You're finding your contact lenses are painful or uncomfortable? Want to know why? I'm going to give you the top 4 reasons. Stick around. Alright guys, before we get into it, I'm Dr. Joel Hayden. Welcome to the Eye Care and Wellness channel. If you haven't been here before, I'm an optometrist and nutritionist. If you like what I have to say, please hit that like button. Please consider subscribing. Let's get at it. So before I delve into the 4 reasons, I want you to know at the end I'm going to tell you the #1 contact lens types that cause all of these issues, so that if you are wearing one of these types of lenses, you may want to consider changing. Alright guys, in no specific order, reason #1, the reason that your lenses may be bothering you comfort-wise, is that it may not be fitting that well. If it's a new contact lens to you and you're wondering, is it the lens or is it me? Well, if it's really uncomfortable, something's off. So it's definitely worth a return to your doctor, and don't put up with it for long. There's usually a time limit on your doctor's fitting fee, and you want to get right back in there and let them know. If it's more of an awareness that the contact's there, that can get better, especially in the first week. So don't freak out over that. They're going to settle in, you're going to like them, but if it's painful or really uncomfortable, something's off. Get that checked. Reason #2, which may be the largest reason of them all, is your eyes are dry. Even new contact lens wearers may get dry eyes. Women over 50 almost always get dry eyes. So sorry, but it's a hormonal thing, and your eyes definitely get dry as you get into your 50s. I want you to, if you think that that's the case, you may be wearing the same contact lenses for years, and all of a sudden they're bothering you. Well, it probably is dryness. So check with your doctor. Watch this video that I'm going to put up here on dry eyes and taking omega-3 fish oil pills, which will definitely help. And if it is dryness, your eye doctor may have a better lens for you to go into to make it more comfortable. #3, you may have a contact lens solution issue. And if you've been using the same solution all along, it's a brand name solution, whether it be Optifree, BioTrue, Renew, ClearCare, that's probably not it. But if you've been using any of the generics, CVS, Walgreens, Walmart, Target, about every 4 or 5 years, they will usually contract out to a new manufacturer, but the bottle looks the same. So you're reaching for it thinking it's the exact same bottle, and what's in it is different, and your eye may not be liking that. You may have a sensitivity to the preservative that's in that solution. Watch this video on generic contact lens solutions and consider going to one of the regular brand name solutions. The 4th reason, which is environmental allergies. Environmental allergies are very, very common, and they tend to be in the spring and the fall, at least in the Northeast, and they can really give you some discomfort, some itching, redness, scratchiness. So if all of a sudden you're going along, everything seems fine, it really bothers you, 1, you can try over-the-counter allergy drops. Something like a Pataday or a Zatador. Pataday is once a day, you put the drop in, wait 10 minutes, put your contacts in, go all day. If it's Zatador, it's twice a day. So you'll put the drop in, wait 10 minutes, put your contacts in, go all day, and then after you take the contacts out at night, put the drop in again. And that may help, and hopefully it'll help you through the season. If it doesn't, call your eye doctor. Again, there may be a better lens for you to wear to decrease your ocular effects of the environmental allergies. I promised you at the end that I would be telling you what type of contact lenses give you these issues most commonly. And outside of the ill-fitting lens, the first one, the next 3 all are much more of an issue in monthly contact lenses, and even 2-week lenses, especially when people are stretching them to 3 weeks and 4 weeks. You just cannot get enough stuff off of those lenses. Environmentally, there's stuff out in the air that will get on those lenses, and as much as you think you can clean them off, well, you can't, and they're going to keep bothering you. So the solution to the monthly lens issues go to dailies. Dailies solve the problem. I've said this a number of times. 10, 15 years ago, I was seeing a dozen people a week in for contact lens issues that are now gone. They're happily gone. They're still my patients, but they're not coming in with these contact lens issues, all because I moved them into daily contact lenses and solved the problem. I hope that helped. I hope it helps drive you to wearing contact lenses that are much more comfortable. Again, if you like this, hit that like button, consider subscribing, and until next time, take care.